Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Well, welcome to the Taylor Method for Pain-Free Living podcast. I'm here with my guest, Randi Lundi, who is a certified concierge registered nurse practitioner that has been doing this for over 40 years, helping patients with chronic health conditions, rehab needs, and just a patient advocate for a variety of different conditions. Randi, welcome to the show. We're excited to have you on.
Dr. Taylor's Pain-Free Medical Center. I kind of like that little ramble you went on there.
Yeah. So, Randi, we're on this show here because there's a lot of people out there that have chronic health conditions, or they're in a rehab situation at home, or maybe there's somebody here who has a parent that is living in the area and they just need a patient advocate. Tell us a little bit about what you do here as a concierge practitioner.
Well, the first and foremost thing that we do, Dr. Taylor, is we keep people at home. They want to stay home. They're the people that can afford to have private duty medical and healthcare services in their home. Mm-hmm. With the advent of COVID, as you know, people have become very germophobic. And instead of somebody going into a facility, a hospital, a rehab facility, an assisted living facility, they want to stay home and they don't want to be exposed to any potential COVID infections. So they would call us. For example, you mentioned advocate. Children live up north, mom and dad live down here. They need rides back and forth to their medical appointments. They need somebody in the exam room. If they came to see Dr. Taylor, for example, they want my eyes and ears in that exam room so I can explain to them exactly what we said, exactly what Dr. Taylor has said, so everybody can be on the same page moving forward with any types of interventions or procedures or treatments that have been asked for by the attending physician.
Right. So this is a true concierge type of service that you're offering, and this is huge because we're living in an age of convenience here. People don't like to have to deal with going to the hospital or a doctor's office. They don't like to have to try to figure things out themselves. They want a done-for-you program, and that's what you kind of offer here, a done-for-you concierge type of service for those that are looking for that, correct?
That's correct. I mean, you've seen the traffic in South Florida recently? Nobody wants to get in their car and drive 10 or 15 minutes even. So,
yep.
So I do driving, I do cooking, I do laundry services. I make sure the house is taken care of. I communicate with the house, and there's a lot of folks that have estates, and they have an estate staff. So I'm part of that staff. If they want to go to dinner or social functions, I go with them. If they need to fly from Palm Beach International Airport to Detroit on their private jet or commercial, I fly with them. I'm an escort. So there's a whole breadth of things that we do as concierge private duty clinical nursing staff that go far beyond anything conventional that nursing does.
Right. Now, you've been doing this for quite some time, over 40 years. You've worked with quite a few different celebrities and politicians, Fortune 500 owners. What's that like working with, these people here that are functioning at that level and are requiring that type of level of care? What's that been like for you in your experience?
Well, my 40 years of nursing have been started off as a military Army, U.S. Army Nurse Corps officer. So I learned all that, taking care of the colonels and generals in the hospital, which definitely demand concierge care. But I think one thing I've learned is that the folks in concierge care, Dr. Taylor, have a very high expectation. They expect you to be timely. They expect you to be right all the time. They want things done in their way. So it's very much like a yes, ma'am, and a no, ma'am type of job. I've got to say that even though I've taken care of celebrities, politicians, athletes, Fortune 500 corporate people, almost all of them have been so gracious. They've been humble. They allow us to do the jobs that we need to get done. Sometimes they don't want to get up, and they've had their knee replacement or their hip replacement, and they don't feel like getting out of the bed or walking or doing their exercises. And I say, it's now time. And there is no negotiation here, sir. It is time to do what we need to do, or you're going to be stuck in this chair for a lot longer, and you're going to have to pay me for a lot longer. And I don't think you want to do that.
Right. Well, that's what I like about you. You've had that military background. You're a no nonsense kind of guy. I know you, Randy, here in the little time that I've gotten to know you here. And people need a little kick in the butt like that sometimes, especially when they're groggy from medications or they're not feeling up to par. They can slip into a depression. And so they need somebody that's going to be loving and yet firm at the same time. And you offer that. And what I also like about what you do is you have this vast knowledge. You've seen so many things, and just in medicine, you know how to handle these different medical conditions, but then you're not afraid to get your hands dirty and do laundry and just help out in any way that you can. You really got a real servant's heart there to serve them to whatever capacity that they need. Now,
yes,
with the concierge practice here, that the landscape has changed with that over the years, hasn't it? Can you tell us what you've seen, how that has shifted? The people that used to could only get concierge before in the past, and people that are calling you, asking for your services now. How has that shifted and changed over the past few years?
Yeah, I would say probably in the past 10 years, but most specifically in the past 3 years since COVID. Concierge private duty care always tended to be something that was for kings and queens and the very rich and the very fortunate. Now, with the advent of COVID, with the advent of so much more that we do for example, 60s and 70-year-old folks now are getting knee replacements, shoulder replacements, hip replacements now than we were doing 10, 15, 20 years ago. Mm-hmm. So their functional status, they would like to maintain. So now, if somebody can have direct one-on-one care in the home, they see the value of that. Sure. And they're able to afford us coming into the home and do these services, as opposed to going into a rehab hospital for 2 to 3 weeks and seeing a physical therapist, maybe once a day for 15, 20 minutes. They're getting us round the clock if they so choose. And we constantly work on improving their condition. The big advocation I see here, Dr. Taylor, the big difference, as you asked, is people want to return to the greatest level of independence and functioning that they possibly are able to. And they do realize that if they stay home and become victims of a chronic condition, become a victim of a procedure, that they will, the more that they stay still and remain dormant, the less opportunity they'll have to return to their prior functioning. And that's why this has been, when I say this, concierge private duty care, that has very directed, it's very goal oriented, that we want to make sure that we optimize people's functioning and their ability to remain any level of independence they possibly can.
Mm-hmm. Right. No, that's absolutely crucial. I mean, because they can just slip into a slippery slope that just spirals downward, and it's hard to get back up once you've hit that bottom there, isn't it?
It's very difficult. And we've got people looking over our shoulders all the time doing our job. A lot of these patients come to us through registries, and a registry will call me and say, I've got a new case for you. Are you interested in taking up some opportunities and taking up some shift work with these folks? I also do a lot of specialty high-tech intravenous infusions for people that have autoimmune deficiencies. And so we see a lot of this as well now, where people used to go to infusion centers where there were 4, 5, 6 recliners, where there'd be 4, 5, 6 people at one time with 1 or 2 nurses. Now the industry is thankfully supporting individual nurses like myself going into folks' homes and doing these high-tech infusions that take anywhere from 4 to 8 hours at a pop. And so that's another opportunity if people need infusions for autoimmune problems, if they're challenged with low levels of nutrients or supplements, a lot of vitamin type of infusions that we do to get people nutritionally balanced so they have the intrinsic properties to allow them to maximize a rehab or healing process.
And how long have you been doing infusions for?
Oh boy. Well, probably ever since I was able to starting peripheral IVs back in my military days. I came right out of college, raised my right hand, took my oath, was commissioned as a second lieutenant, and they sent us off to all the places anywhere that we needed help to take care of troops. So I learned real quickly how to deal with trauma. That was a big thing that I learned with the experience that I gained with in the military with trauma, acute care, emergency care, logistics, and planning. Very much a part of my skill set today, way back then. And I still use a lot of those same skills today to be able to manage and process folks. And I got to say, Dr. Taylor, probably 90% of what I do is relational and interpersonal. 10% of what I do is a hands-on clinical care, as your practice does. In my experience with your practice, you do a lot with me with hands-on, but you do so much more with me than like monitoring my condition, my progress, making a care plan for my specific needs. I remember walking into your place and going through my initial evaluation, and you said, "Oh my goodness, what a mess." And I said, "Yeah, my x-rays on the x-ray report in the written report says the same thing. You're a mess." And so what we try to do is we try to clean up messes. We try to change things and change the paths that people are on, again, to keep them mobile. And if we do a good job as private duty concierge care deliverers and communicating with families and with, like, for example, Dr. Taylor, if you sent a patient to me and said, "Randy, this person needs your services twice a week, 3 days a week for a month." And at the end of that month, you're going to expect to see some significant improvements, because that's my reputation and your reputation on the line as well. So I have responsibilities not only to myself of maintaining my skill sets and my ability to be effective in interpersonal skills, but also results. This is a very much a results-oriented outcome, because if we don't get the outcomes and we don't get results that keep people healthy and improve them along their continuum of health, we're not going to do well. We won't survive.
Right. And so your services now, you've probably it's a big range, right? You have a minimum. What is your minimum to go to somebody's place? And
well, usually for my services, depending on what the service is required, I would charge anywhere from $50 to $75 an hour, and that would always be at a 4-hour minimum. I've done 12 hours straight. I've done 24 hours straight. There's people that come home from hospitals after surgery and they need a good 12, 24 hours of monitoring. So I bring in a second person. So we rotate people into the shift work, so we're not being delirious ourselves. But that's the range, and a lot of people can afford $50 to $75 an hour. It's
Sure.
not out of the realm of affordability.
Oh, I mean, for 40 years of experience and have the expertise and the wisdom and the knowledge and the experience that you've had, I mean, that's a very reasonable compensation that you're offering there for that. And sometimes you have people that they just need a 4-hour stint, just this afternoon, we don't have anybody here. Can you come here for 4 hours or 5 hours and do the therapies with so-and-so and give them their infusions and take care of them? And that's a big break for people that are, let's say they're a caretaker for somebody who's in need. To have that 4 to 5 hour break, that's a small price to pay to get that level of care.
Well, a lot of family members, they do realize that they have limitations, and they can do a lot of things for their loved ones, but there's a lot of things that they cannot do. They don't feel qualified, or mostly they don't feel comfortable doing. And that's where we come into play. So concierge care, private duty care, as you've mentioned, it is necessary. It certainly has a value, and and from a cost perspective, it is not out of the realm. I mean, you're going to pay a mechanic $50, $60 an hour. You're going to pay a plumber and an electrician $100 an hour.
Sure. Right. Absolutely. And I like this idea of being a patient advocate. How often are you going with a patient to their doctor's appointment? Let's say somebody from out of state is calling for they're looking for someone like you to help handle some of the medical needs of their aging parent. Is that something that you frequently do for your clients?
Yes. If I'm on the shift that day and they have appointments, so whatever appointments they have during a said day, I would go on. For example, over the weekend, I had a patient that had an appointment for personal business. Went with that person because this person had some orthopedic procedures and needed assistance. And then during that same day, that individual had left the house because he was feeling better and wanted to go to lunch and dinner, getting out of the house. And so I would go as an escort and be part of that. Sometimes I ride in the back seat with the family. Sometimes I'm the driver of the vehicle. So there's all kinds of things that we have to be ready to do. We have to be qualified to do. And from a customer service perspective, my response is always, yes, sir. Yes, ma'am. We can do that, and we can make that happen.
Yeah.
I may not have all the answers immediately, but I will find the answers to make sure things get done.
That's great. And there's just a level of assurance and comfort just knowing that hey, this is going to get done, in a day and age where things just aren't getting done just because the level of services out there in some areas are deficient. It's nice to know that, hey, if I want to get the job done, I'm going to give Randy a call. Now, how many do you have quite a few patients that are recovering from a hip replacement or a knee replacement? And how long do those typically last for, those kind of patients that you'll see them for before they're up and running and functioning on their own?
I have joint replacement patients all the time. Those patient referrals never stop. We get those folks all the time. Rehab wise, it could be, usually our services as nurses, they'd want us for at least 2 weeks. I've had some cases where it's been 2 months, depending on how complicated the procedure was, how complicated the recovery is. There's been procedures where people have the joint replacements, they may go sour. The wound incision may become infected. So the surgical site, operative site has to be opened. And then we do specific high-tech wound care interventions. Doctors don't like to do that. They have us nurses do those things. So I've been involved with regular standard protocol recoveries. And I've been involved with, unfortunately, some of the things that go awry and go wrong, where you're 6 months after a procedure and you're still trying to recover from something that went wrong. And most often it would be like a post-operative infection, a wound infection, a surgical site infection with deep tissue complications. So hence the infusions, hence the wound care. And then those folks would be limited with their mobility. So when you have mobility issues, you have issues of people trying to prevent people from getting bed sores, from sitting or laying in one position too long. So you can see how rapidly, Dr. Taylor, you can go from one dimension of care to multi dimensions of care. And the families don't want 4 or 5 different nurses coming in to do one specific thing. They want their one trusted nurse to be able to handle all those problems. And I got to tell you, probably the best thing that I really enjoy, that gives me my satisfaction and my level of joy and peace, is keeping family members and the patient's anxieties down. You want to keep the anxiety level down. So hence we become an integral part of their family, an integral part of their care team, and probably in many cases, the most trusted and the most relied upon.
Yeah. Well, I can see how you bring that, because as soon as you walk in the room, they want to know that somebody's going to be in charge.
Well, they like when I walk in on my business card, I have my picture in my Army dress blue uniform, and it says Randi Lundi, RN BSN, Captain, United States Army Nurse Corps, decorated veteran. And they see that on the card, and then the other half of the card, they see me in my dress blue sharp uniform, not like the girly white Navy uniforms, of course, a very sharp dress blue Army uniform. And that sets everything off wonderfully.
Wait a minute, don't you realize you just offended all these Navy guys here?
Oh, geez, did I really do that? It must be something that's so subconscious. To all my Navy sailors out there, I will say, we like you guys, because anytime we have to go fight, you give us a ride. Thank you, Navy.
Oh boy. All right. So yeah, I mean, and if you can handle those things in the Army, my goodness, you can handle anything, right? I mean, everything else is nothing compared to the stuff you've been dealing with, I'm sure.
Oh my goodness. I would tell people all the time, this is nothing. This is nothing to get anxious about, nothing to get excited about.
Right.
And I says, when the balloon goes up and you got bodies flying in all over the place and you got to keep people alive and you're moving from one to the other and you don't sleep for 36 hours. I said, that's when the balloon is up, that's when things have to get really sticky and scary. Yeah.
Yeah. Where did you serve in the Army?
Oh boy. I'll give you a litany if I can quickly. Started off at Brooke Army Medical Center, San Antonio, Texas, at the Academy for Health Sciences. Went out in the field for training to Camp Bullis in the middle of Jackrabbit Country in South Texas. Then from there to Eisenhower Medical Center at Fort Gordon in Augusta, Georgia. From there, went to Grenada for a week when President Reagan sent us to Grenada to take care of that little incursion. And that was fun. After that, I came back to Eisenhower in Augusta, went to Womack Army Hospital in Fort Bragg to teach medics. And the Army does have their own LPNs, licensed practical nurses. So I taught for several months for medics and LPNs. Then from there, sporadic assignments at DeWitt Army Hospital in Alexandria, Virginia. And that was beautiful. That's the home of the engineers, beautiful officers club, beautiful golf courses. Went to Tacoma, Washington, Fort Lewis at Madigan Army Medical Center there, and was on the deployment for Operation Desert Shield.
Wow, it's incredible. Now, lastly, your chronic health patients. What kind of chronic health conditions have you helped? Have you seen your patients have that you're constantly going to their?
Well, you can pick one, and many of them don't have one. They have it's multiple.
Multiple, right?
So you're talking about diabetes. You're talking about respiratory disorders. You're talking about cardiovascular disorders. You're talking about a lot of endocrine disorders. And I hate to say this, but after COVID, with all the vax mandates and the booster mandates, I've had a lot of patients with some serious complications and side effects from their vaccines and their boosters. And that's mostly been neurologic in order. So that's, I'm dealing with a lot of long-term rehab with patients who suffer from those types of maladies. But it's across the board. It's across the board. Some preventable, as the vaccines and boosters without mandates, I wouldn't be seeing nearly as much. And some of the stuff is not preventable. It could be congenital or hereditary.
Mm-hmm, right. And you mentioned autoimmune conditions. You see a lot of autoimmune issues there as well.
Yes, correct. Common variable immunodeficiencies. Yes, we have a lot of people with compromised immunity. And again, because of COVID, people have taken a very, very strong look at their own personal health. And if they've had issues with immunity or low platelet counts, they've gone to the physicians, and the physicians have been very aggressive in trying to maximize everybody's own personal immunity. And a lot of times that does include infusions of gamma globulins once or twice a day for every 3, 4, 6 weeks. So we do a lot of specialty infusions so the folks can keep their antibody levels up and keep them as safe as we can against really any type of infective process. But everybody's right now worried about making sure they can keep their white cell count up so they can prevent getting any COVID infections. But the good thing about COVID now is we're now down to subvariants of variants. And the most significant problems that I've seen with any COVID infection in probably the last 18 months has been sinus respiratory flu-like symptoms that are nowhere near lethal. There's very little morbidity. So that's the good thing going on right now.
Yeah, good. And I know people are going to ask this, but hey, I'm sure you get this all the time. Does my insurance cover your services? What do you say to people that ask that question?
That answer is no.
Yeah.
That's why it's called private duty, private pay.
Right. I'm sure you get asked regardless, right?
Yes, concierge. No,
anything that's going to be at this level, your standard health insurance isn't going to cover this level of care. They don't cover this unless
it's the level of care that you get from us in the concierge private duty industry. It's what's the word I'm looking for? It's top shelf, I guess I would say. It's like you're going to Carmine's and you're pulling off the top shelf for your cocktail. We are top shelf people, and the services that we provide, the wealth of knowledge that we bring to situations you can't put a price on those things. You can't put a price on people's comfort level. You can't put a price on family members' peace and joy. And when you work with people and you see people are staying healthy, staying safe, staying out of hospitals, they're not as ill and sick as they are. They improve because of the procedures that are done to their hips, shoulders, or knees. That is where our outcomes, and that's where our sights are always placed upon.
Right. Well, people have this notion that this little insurance card that's going to take care of all their health issues, right? They have this erroneous mindset that this is all I need is this, and that's going to take care of everything. Well, it may to a degree, but you're going to have to jump through a lot of hoops. You're going to have to go through a lot of paperwork, and you're going to have to kiss a lot of toads before you find the right person that maybe going to help you sometimes.
And then you know what?
The level of care is just going to be.
You do all that work, Dr. Taylor, and guess what? You still get denials. If your practice, spinal health practice, which if you don't mind, I'm going to give a plug. Your spinal health practice has relieved me from years of just trying to figure out what exactly is wrong. Now, being a 40-year plus registered nurse doing what I do, I knew there were things that were wrong, and I just never realized how compromised my spinal health was. I was the first nursing student at my college to play football, which was a unique experience. When I got in line to get my equipment, the equipment manager didn't hand me a helmet. He handed me a nursing cap. When I got in line to get my cleats for the football field, he didn't hand me cleats. He handed me white nursing shoes. So that was quite the experience. But
Right.
But if your practice depended upon insurance reimbursement, you wouldn't have a practice. So,
Right. Well, what you end up doing is you end up treating the insurance company rather than the patient, right? And because you have to do the standard that they want you to do, and that's not going to be what's best for the patient necessarily, correct?
I got spoiled. When I came out of college, I had a really good commanding general at Eisenhower Medical Center in Augusta at Fort Gordon. And General Cutting, he said, in the military, in the Army anyway, almost 40% of the nurses are males. And most of us were athletes coming out of college. And so he said, guys, he would meet with us, the second lieutenants that would come in new, and he would say, guys, he says, you are my backbone. You do what you need to do to keep this place going, and you do what you need to do to take care of these soldiers, and you do what you got to do to take care of these physicians, because they work really hard. So when I first started as a 22-year-old coming fresh, no experience in nursing, they threw us out there and they let us do things that you would never remotely come close to doing in civilian nursing. And that built a tremendous amount. I'm a confident person by trade, but the confidence in having someone's life in your hands and knowing that you can manage that set me to a really, really good flight plane. And I don't like to compromise with healthcare. I don't care for hospital care. I don't care for what goes on and the productivity and the profitability models in acute care hospitals, because it shorts quality patient care. I like what I do because I've got nobody putting restrictions on me. We can take care of what we need to take care of right now and get it taken care of today.
Right. Give me a recent example of somebody that you've been able to help, and just by using your services, and how they would have had a completely different outcome had they just gone with the standard insurance route, and how your services are unique in that way. Can you think of a recent, I'm kind of putting you on the spot here. We didn't talk about any of this before, but can you think of anybody recently or something that's
sure.
out in your mind?
Sure. Yeah. This is a very most recent patient, had a double knee replacement. It's
done at the same time.
Yes, sir. Gentleman's is over 90 years old, very sharp, very capable, very strong guy, part of the Fortune 500 world, and went in with him, and he was afraid to bend his knees. And I said, sir, you should not be afraid to bend your knees. You know why? He says, well, it hurts. I said, I know it hurts. He said, and my knees are swollen. I says, I know they're swollen, but we're going to put on the polar packs. We're going to ice you down. We're going to move you, because those new knees you have, they work. Your old knees didn't work. The new knees, they're designed to work. So in the course of less than a month, this gentleman is up, barely using a walker now. He's able to get up and down. The hardest thing for people with hip replacements and knee replacements is going from a sitting position to a standing position, standing to a sitting position, especially getting in and out of cars. It's very, very difficult to do that. And we've got this because we were aggressive with his rehab. We pushed him a little bit, but we gave him adequate rest. We iced him down. We elevated the legs. We gave him massage. I do massage therapy. So we were rubbing hamstrings, rubbing glutes, rubbing quad muscles, stretching the calf muscles. And now this gentleman, at over 90 years old, within 30 days of a double knee replacement, both at the same time, is barely using a walker now, almost to the point where he's totally independent, and we'll probably stop services with him in about 2 weeks. But that's a great example of how we can really move people along and get them to the point where now he's back to independence. He's able to do what he wants to do with his wife, with his family, and he still works. He loves to work.
That's invaluable. I mean, how long would that have taken if he had gone through the portals of his Medicare insurance for him to get to the level where he's at now? How long would that have taken?
Well, conventional would have been from the hospital, from the hospital to a surgical acute care rehab facility. And then there, physical therapy might have seen him once or twice a day, get up, move, walk a little bit, do a little passive range of motion. And then he goes back to bed or sits in a chair. Without socialization, with an unfamiliar environment. Now he's at home. We're there for, when I say we're there for 24 hours. Yeah. I'm there for 12, and somebody comes and follows me for 12 hours. So he's got one-on-one attention. You have socialization. He's able to be in a comfortable environment in his own home that he knows very, very well. He's got a support structure there with his family, not being told when visiting hours are. He has total independence with his relationships. You can't even compare it, Dr. Taylor. There's no comparison.
Night and day. Wow.
Yes.
That's inspiring. That's really inspiring. It's amazing.
Thank you.
I think what you do is an incredible service. That's why you're on the show, because more people need to know about what you do. How can they get a hold of you, Randy? If somebody says, yeah, this sounds like something I'd like to learn more about, how can they best get a hold of you?
Well, I'm right now, at this very moment, I would say two ways, and one would be imposing on you. They could always, hey, Dr. Taylor, who was that guy that you had on that did that private duty nursing?
Okay, so I have permission to give them your number if they ask.
And you have, I was going to say, the second thing is you do have permission to give them my number, or I can give my number out right now if that you think that would be helpful.
Yeah, that's what I was talking about. Right. Go ahead and give that.
Okay. So yeah, my phone number is 561-252-6449. And again, that's Randi Lundi, 561-252-6449.
Randi with the Y, Lundi with an I.
I float like a butterfly and I sting like a bee. That's why they call me Randi Lundi.
Now, now, interesting. You're known as the singing captain. That's a little side note most people don't know about you. Can you tell us a little bit about that as we close our show?
Yeah, certainly. I'm the singing soldier. Yes. I grew up in a very musical family. Started singing a cappella gospel music with my father's church choir. It was all male men's a cappella gospel choir. Probably when I was 8 years old, and did about 14 or 15 off-Broadway shows in my teens and 20s during high school and college. And kind of put music on the shelf for a while, but for the last 15 years, I've resurrected. We've got a really nice shtick that we have with myself, Captain Randi, the singing soldier. My singing partner is Commander Jim, the singing sailor. And we have Sergeant Denny, the singing sergeant. We call ourselves officers and gentlemen. We're all veterans. We've sang for congressmen. We've sang for senators. We've sang for President Trump. We've sang for all kinds of fun special events, the museum events, charity events, honor flight at the airport. When honor flight veterans come back to Palm Beach Airport and they land in the airport late at night on a Saturday, there's about 2,000 people that line the concourse to welcome them home. And they bring us out there and we're in full uniform, just having a great time and singing. And I also have a full harmony group, 5 of us, 3 guys and 2 dolls. And we're a full 60s, 70s genres of music with full harmonies. It's a great Vegas show band.
Wow, it's great. Wow, you do it all.
Well, thank you. No, we have so much fun singing. The good Lord has blessed us with so many different talents, and God gave me the opportunity to get back to share my talents and my time with music, and I have the opportunity here, and it's been nothing but a blessing. So all those things that happen, they happen for a reason. I'm just blessed and thankful.
Yeah, that's great. Well, our guest today has been Randi Lundi, the singing soldier and concierge, certified registered nurse. It's been great. Thank you so much for sharing your knowledge and what you do with us. And I think you're going to be getting some calls because it sounds like what you do is just invaluable and you have a real unique gift. So thank you for sharing that with us today.
Yes, sir. And thank you for the invitation and the opportunity.
All right, great. Thanks for the show. This is Dr. Derek Taylor signing off.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.